Hello, good afternoon. Am I audible?
Yes, you are audible.
Good afternoon, everybody. This is Manjunath from Sri Sri Ayurveda Hospital. I manage our hospital's social media and website and promotions. In this meeting, we have a moderator from our Sri Sri Ravi Shankar Vidya Mandir, and this live webinar is hosted in collaboration with SSRVM Trust and Sri Sri Ayurveda Hospital on our social media. So in another couple of minutes, we will be going live on Facebook. If all other panelists and moderators can turn on the video, it would be helpful. Chinmay, if you could drop a text in the chat box when we are live, maybe Ananya can start from there on. Or if you would like to introduce anything. We are live.
Hello everyone. We are going live now. I request Ananya to start the session with the questions. We have on our panel Dr. Aarti Mohan, BAMS MD, Dr. Manav Sharma, Dr. Siddharth Parekh, and Dr. Kajal Doshi. Ananya, please go ahead.
Of course. Hello, everyone, and good evening. I am Ananya Gadde from SSRVM Mulund branch. There are many questions that all of us have related to medicine. It is a very integral part of our lives. So there's a few questions that we have all gathered from social media, from our peers, and those are some questions that we would like to ask of you. My first question would be to Dr. Aarti Mohan. As I know it, are uh, you are into Ayurveda childcare, and there's many questions that are to be asked about Ayurveda. It is a very integral part of our Indian lifestyle, and here's one of the questions that we received. I'm a parent from Bangalore. My 5-year-old daughter seems to be restless and hyperactive throughout the day. Can you share some tips to help my daughter be calmer and reduce her hyperactivity? This is the question that came to us from Bangalore. Could you please answer that?
Yeah, sure. First of all, Jai Gurudev. I am Dr. Aarti. I am from the Department of Kaumara Vritya, Balaroga, consultant pediatrician at Sri Sri Hospital, and I am also assistant professor at Sri Sri College, Bangalore. We are a team of 5 doctors. We are guided by Dr. Sudhir sir. He is the HOD and professor to the department. There is Professor Dr. Divyashree ma'am and associate professors Dr. Sharvari and Dr. Kripakaran sir, myself. So regarding your question was regarding hyperactivity, no?
That would be correct.
Yes. So generally, when you say what was the age of the kid you were saying?
It's a 5-year-old daughter.
Yes. See, for a 5-year-old kid, when you say hyperactivity, it is like a general phenomenon. They will always be on the go. They will be always very inquisitive at that age. These preschoolers, they'll be always attention seeking and they'll be getting bored all the time, distracted, always fidgeting. So when you say hyperactivity, that needs to be examined. Okay, everyone will see that the child is on the go always like a screw. But again, when you say hyperactive, that really has to be examined. You cannot say based on how they are behaving. Okay, so that is one thing. When you label it, you have to do it on based on the assessment tools. So if to label a child as so, that has to be through the proper channels under a clinical psychologist. They have to come and assess the child, and then only they can name the child as active or hyperactive or inattentive or so. Okay, so if the child is hyperactive, if you are seeing and okay, you have done the assessment, you have done the part, and again the child is hyperactive, the child is on certain medications. See, always these children have a lot of energy. Okay, so either this energy has to be worn off, or you have to spend that energy on something, or you will have to direct that energy onto something. Like when you say burning out of that energy, you can engage the child in physical activity in the sense more of into games or sports, something the child is very interested in. You make the child join in that. Could be swimming or football, where a lot of physical activity will go in, lot of energy will be wasted in that, or expenditure on that. Another thing is, if the child is on a trail of thought, you can just cut that trail of thought by, what do you say, a simple game can be used. Like if the child is on say if the child is on a queue, on a long queue or something, you are with the child, and the child might melt down any moment. So then you can introduce small games, like you can ask the child to guess something, okay, or to find something from that distance. You can name an object and ask the child to find out from that spot itself, or maybe do a rock paper scissors game or something. Okay, you can play with the child and engage the child in that way. That way you can break the pattern or break the trail of thought. So that is one way you can break the trail of thought, or you can catch hold of the attention. Like if anything, you have to make the child understand, or ask the child to if you want something to be done, you have to maintain eye contact with the child. You can just pat the shoulders, or take the arms of the child, make an eye contact with the child, and give your commands in simple, brief sentences, not in multi-steps, multi-directional, but say in simple sentences which are very brief, the child can pick. Okay, that is one thing. If you want the child to be engaged in something, if you want to gain the attention of the child, that is for the school years, I'm saying. If you want the child to complete the work in a certain period, you can set the limits. Say you give a 5-minute work for the child, give a 2-minute break, then again a 6-minute work, give some 3 minutes break or something. Let the child do whatever the child want to. Maybe he can run around and jump a little, lose some energy off, and then come back to the work. Okay, always have a schedule for the child. You should tell the child what is expected. You have to first inform the child what is expected. Okay, this is expected from you in the morning. You have to rise up at this time. Then you have to go to bed by this time. Okay, this work you have to complete at this hour. This is the place you have to do your work. Okay, the place where the child works should be minimally distractible. Okay, no sounds. Okay, or no big pictures or colorful things which will catch the attention of the child. You move everything from the space where the child is working, so that you can get the attention of the child. Understood? So it should be time bound. You have to give a structure to everything the child is doing, right from getting up in the morning to sleep. All the activities has to be structured. Okay, so consistency, if you're practicing that consistent, for this consistency, even the family has to be structured. Okay, everything the family is doing should also be structured. The mother and the parent should be getting up in a particular time. They should be having a regular chore, or a regular routine should be maintained, so that the child will try copy, and child will know, okay, this has to be done. And it should be like a goal should be there for the child. Okay, once the child completes the goal, some reinforcement, as in the form of a prize or a reward, should be given to the child. It could be a hug, it could be a cuddle, it could be a sweet, or it could be small money, like in rupees or something. A reward is demanded. Okay, you can punish the child or criticize the child for a bad behavior, but you should equally encourage the child or praise the child also. If 5 things you criticize, make sure some 10 times you have actually praised the child. Okay, how the child receives a thing, like a hyperactive child, if you name it, they will always have the expectation that they will get the scolding, or they will get the scolding for their behaviors. And also they will take it very badly. Their self-esteem will be very low. They will always think I am no good, or I'll always do bad things. I'll always, complicate things, or I'll do the wrong things. Their self-esteem is already low. So make a point that if you're criticizing the child, equally or more, you are giving good enforcement or good, prices to the child also. Okay. So for all the goals, every goal, you should be rewarding the child. That is one thing. So structured and goal-oriented, you have to praise the child, and you have to, redirect the energy, or you have to bring down the energy by directing to physical activity. These all are things which will make the child calm. And also, the child and the parent, they should have a strong bond. Okay, it is the duty of the parent to be there for the child always. The parent should always maintain a calm status. Okay, the child is has melted on already, and the parent is on top of the voice. That will not be helping. Always the parent should be calm. The parent should be empathetic to the child. They have to understand if a meltdown is about to happen, the parent will understand, and it is the duty of the parent to calm down the child. For that, the father or the mother should be calm first. Okay, so they always have to be calm, and they have to understand the kid, what is going on in their mind, what is their problem. The parent should be able to understand. They can also teach calming techniques. Like whenever you feel overwhelmed, or whenever you feel a burst out, what you should do, you can count till 10, or you can count till 20, or you can have a happy thought, or you can sing a song, whatever the child likes. Okay, so this way you can direct the child. So these are some ways to calm the child. But first is you have to come to the OPD, or you should approach a pediatrician to make sure the child is having some issue. Because the children of 5 years, that is normal for the age.
Hard to understand.
Yes, it is hard to understand. That is, it is just a faint line. So it is very hard to understand. You should come to us. You should seek the help of others. Okay, before labeling the child as so. So that
Thank you, ma'am.
Okay,
thank you, ma'am, for your insights. We can move on to the next question now. There was one more question for Dr. Manav. Dr. Manav, what is HBOT? Can you help us understand this treatment in simple words? And is it only for treating medical conditions, or can anybody take this treatment? Dr. Manav, if you could answer this.
Hey, good afternoon, everybody. All right, so hyperbaric oxygen therapy is a supportive form of therapy for a variety of conditions. We need to understand how hyperbaric oxygen therapy works first. So, okay, we all know that we have something called hemoglobin in the blood, which is inside the red blood cells, all right? And hemoglobin, the primary function of hemoglobin is to transport oxygen from, to the different parts of the body. And oxygen is carried by hemoglobin in chemical composition form. So oxygen combines with hemoglobin to form something called oxyhemoglobin. And that is what is carried to various parts of the body. Now, 97% of oxygen is in combination with hemoglobin. And just about 3% is actually dissolved in the plasma. So sort of to put it in a very, very simple form, you take a glass of water or blood, let's say, plasma, and then just take some oxygen in a spoon and just dissolve it, just stir it in, something like dissolving it in water. And that is what I mean when I say that 3% of oxygen is in dissolved form in the plasma. Under normal atmospheric conditions, which is 1 atmosphere or thereabouts, in Bangalore is slightly less than 1 atmosphere. Okay, sea level pressure. Now, when we give oxygen to an individual under pressure, now we must understand that the oxygen is not under pressure. The oxygen is given just by a mask or by a hood to the individual. but the environmental pressure is actually increased to that beyond atmospheric pressure. So we say that the atmospheric pressure at sea level is 1 atmosphere, or we call it 1 ATA, that is 1 atmosphere's absolute. When we take it to anything above 1 ATA, anything above 1 ATA, it is hyperbaric. The environment is called a hyperbaric environment, or an elevated pressure environment. Hyper, right? Like you have hypobaric, which is reduced pressure, you have hyperbaric, which is increased pressure. So in an increased pressure environment, when the patient is given oxygen, 100% oxygen, that is what is known as hyperbaric oxygen therapy. It needs to be very clearly understood that the oxygen itself is not delivered under pressure. The oxygen is delivered just normal pressure of oxygen, and with the help of a mask or a hood. However, the environment in which the pressure is given is a hyperbaric environment. All right. In this environment, what actually happens is that the amount of oxygen that is dissolved in the blood, the glass with the oxygen stirred in, something like that. So that amount of oxygen increases by almost 20 times at a pressure of about 2.5 ATA. So 2.5 atmospheres absolute. We have a large amount of oxygen, which is actually now dissolved in the blood, in addition to the one that is in combination with hemoglobin. And now this dissolved oxygen is what is going to help the patient. Now, how does it help the patient? We also need to understand that. A variety of conditions are such that the blood supply to a particular part of the body is compromised. For example, let's say a person has a diabetic ulcer or a venous ulcer, where because of the compromised blood supply, or a crush injury, where because of the compromised blood supply, the wound is not healing. All right. I hope I'm making myself clear on this. So the blood supply, which means the blood vessels supplying that particular part of the body, are not able to supply blood for some reason. Maybe the vasculature is damaged, or whatever be the reason. In such a condition, regardless of whatever is your hemoglobin, the blood, the affected site will not receive adequate amount of oxygen because the blood is just not flowing there, right? Simple mathematics. No blood, no oxygen. However, in hyperbaric oxygen therapy, even though the blood supply is compromised, the dissolved oxygen, the pressure of the oxygen which is dissolved in the plasma is so high that oxygen simply diffuses out into the surrounding tissue, even though the blood supply per se is compromised, but this oxygen just diffuses out and oxygenates the tissue, thereby allowing the tissue to heal. Right? So no oxygen, no blood supply, or a compromised blood supply, which means no hemoglobin. However, the dissolved oxygen itself is so much that it just diffuses out of the blood vessel, out into the tissues, and supplies the tissue. So this is what is hyperbaric oxygen therapy, and this is how the oxygen therapy works. This is the main mechanism by how it works. Obviously, there are other methods, there are other mechanisms of action. For example, hyperbaric oxygen by itself causes formation of new blood vessels. So where the tissue blood vasculature is compromised, we call it, the term for this is angiogenesis, which is genesis of new blood vessels. So angiogenesis by itself is an effect of hyperbaric oxygen, which also aids in healing of the wound. So multiple mechanisms, but predominant mechanism being amount of oxygen dissolved in the blood is way more than what it is normally, and therefore it helps healing of the tissues. Yeah, so that's it about hyperbaric oxygen.
That made the topic a lot more clearer. Thank you so much, sir. My next question would be to Dr. Kajal Doshi. Dr. Kajal, osteopathy is a new science for many of us. Can you help us understand in layman's language what osteopathy is and how it works?
Yeah. So, osteopathy is a manual form of medicine. It's a manual mode of medicine wherein we use our hands. It's a hands-on approach, or to put it simply, it's body work, right? So using our hands, we do various techniques like mobilizations or manipulations of different parts of your body, be it your spine, your joints, your muscles. So depending on the issue that you have, we can do all of these techniques. For example, a patient comes with aches or pains in the body, be it neck pain, shoulder pain, knee pain, lower back pain. or digestive issues, constipation, acidity, breathing difficulties, or even if a person's unable to sleep, insomnia, hormonal imbalances. In all of these conditions, osteopathy can give a holistic form of treatment. Here we do not give any medicines, and it is completely non-invasive. So how does it work? Using our hands, right? So it works on the principle of our body being a single unit. Everything in our body is connected from the head to toe. Say, for example, if we keep twisting our ankle multiple times, right, eventually what will happen, there will be some dysfunctional patterns that will maybe cause knee pain after some time if left untreated, then to the back, then it might also migrate to your shoulders and neck and head, right? So say 5 years later you fell down multiple times, but then 5 years later you're having a headache because of an ankle sprain. So this is where osteopathy comes in. It aims to treat the root cause and not just the symptoms. All right. So it's not only just for the muscles and the joints, it's also for your organs, your digestive issues, and other such problems. Here we improve the nervous system regulation, the nervous balance. We improve the circulation to various structures so that they heal better, heal faster. We improve the mobility, the range of motion, and also the lymphatic drainage. And hence, this is how it's like a 360-degree or a holistic approach. Yeah.
Thank you so much, doctor. That made osteopathy is already a very interesting subject, and that made it so much clearer to us. The next question would be to Dr. Siddharth. Dr. Siddharth, what is ozone therapy and how does that work?
Hi, Ananya. Hello, everyone. So, ozone therapy. We all know we can't live without oxygen. Oxygen has two molecules, O2. So, if we add one more extra oxygen molecule, it becomes ozone. We have an ozone layer also. It's a protective layer in the environment. So, in ozone therapy is a supportive complementary therapy in which we use 99.5% to 95% oxygen and rest of it ozone. So how it works, how ozone therapy works? We take multivitamins. Why do we take multivitamins? Because multivitamins are antioxidants. They are powerful antioxidants. They remove the free radicals from our body. So there is a antioxidant mechanism which happens inside cells also. So ozone improves endogenous antioxidant mechanism by improving some enzymes like superoxide dismutase, glutathione reductase, catalase, transferase. These are the enzymes. And ozone improves platelet functions. Ozone gives more oxygen to RBC. Ozone improves WBC count in our body. So our immunity also improves with the ozone therapy. Okay. Ozone therapy improves metabolism and it balances the hormonal level in the body. So there are various benefits and mechanism of ozone in the body. Okay, it improves circulation because more blood will go. How it improves circulation? It increases the nitric oxide production in the body. So nitric oxide is what? It's a vasodilator. It dilates the vessels. So if vessel is dilating, more blood will flow in the body. More blood, more oxygen, and more healing. Okay, so ozone improves brain functioning also. Like some post-COVID people are suffering from some memory loss, some memory impairment is there. So for them also ozone therapy is beneficial because it gives more oxygen to the cells. Yeah. And ozone therapy can be given to 61 to 90 plus year old people. Yeah.
That is very amazing, Dr. Siddharth. Thank you so much for your insights. There was one more question. If anyone is taking other treatments, can ozone therapy go hand in hand with those treatments?
Yeah, as I told you, ozone therapy is a supportive treatment. Anybody who's taking any other treatment can take ozone treatment along with that. But while taking ozone therapy treatment, there should be a gap. Like suppose we are giving ozone, we give ozone through different routes. Like we give ozone through ear. There is a ozone breathing through oil, through nose. We give ozone. We give ozone intravenous also. But we should not, while we are giving a ozone treatment, we should not mix it with other treatment. There should be a gap. Parallelly, we can give this treatment.
Thank you very much, Doctor. My name is Niranjana. I'm from SSRVM Bangalore East, and it's a pleasure to meet all of you and talk to you. My first question would be addressed to Dr. Arati. I think as a student, this is a very important question which goes on in everyone's mind. Every exam season brings a great amount of stress to both parents and students. Are there any Ayurvedic practices that can be considered for relaxation and rejuvenation from exam stress?
Yes, thank you, Niranjana. You're asking about stress during examination, right?
Yes.
Yes. So stress, why that stress is coming is the first question, right? So why the extreme stress is coming? A child who knows everything, who has completed the syllabus, there is no point of stress, right? And mostly the stress is happening because the child might be under stress because of some external factors or environmental factors. Mostly it would be the parents, okay, because of the high expectations of the parents and the relatives, that is putting the kid actually on stress. The child is never on stress for their own reasons, right? So the thing you can do is, when the exams are approaching, you will get your timetables right then and there itself. You have to make your own timetable. That's your personal timetable. Okay, you have to set a goal. You have to, like, every day, how much of portions you will cover, in what time you will cover that portions. Okay, in portions which you are weak or your notes are not complete or you are not very interested in, you will have to invest more time. Usually what happens is, the kids who do not like certain subject, they usually want to omit those subject and study only the things which are, you know, interesting to them, or where the teachers, there are certain teachers maybe they like more, so they'll learn their subjects more. Okay, so the first thing is, you have to prioritize based on your weakness. Where is your weak point? So based on that, you have to frame your timetables. You have to set up realistic goals. Okay, from 12 to 12:30, or maybe after school 5 to 5:30 this subject. Some 10 minutes I'll take a gap. Then 5:40 to 6:15 I'll take the next subject. Then again, some rewards you can give. You can have a Kit-Kat break in between. Okay, once you have completed a certain portion, you can have a treat for yourself. Okay, so you can reward yourself. Then what? Yes, once you have set the timetable, make sure you're adhering to that. Then the next thing is, you have to practice some pranayama techniques. That being from the SSRVM fraternity, you already know all the breathing techniques. Yes. So how to control your mind, body, yoga, pranayama, that is equally important. If not, you are doing in a regular basis. Once you get the timetable, surely morning and evening, it's necessary or mandatory that you do the pranayama. Mostly the breathing exercises is completely necessary. Then 2 to 2.5 liters of water daily, that is also completely necessary. Some 10 to 20 minutes walk, have some fresh air in between. Like when you are setting the timetable, you give a 15-20 minutes break just for a walk, for a brisk walk, out in the out and have some fresh air, or maybe some chit chat with your friends. You should take a gap in between for all these things. Okay, this makes study more enjoyable. And there would be certain what do you say, when it is very confusing, there are, like in history and all, you'll have many dates. No, to study these dates, you have to tie it with an event that happened in your life or something, like a code or something you make. With that you study. Okay, so in that way you can make even the World War could be interesting to you if you relate with certain events in your life, or maybe you can make an imaginary story and tie it to that and study in an interesting way. If you are studying in an interesting way, you surely will write the exam in an interesting way. Yes, and it is up to the parents. Their parents have to be, often I have seen parents coming to OPD. The stress is more on them than the kids. Okay. So I think the pranayama needs to be practiced by the parents as well during these exam sessions. Hydration, 7 to 8 hours of sleep is absolutely necessary. Okay. And giving treat for yourself in between the study sessions. So I think that will clear out the stress in children. If the stress is much, if it is interfering with your exam performance, then surely you have to approach the pediatrician for help. That is all. Otherwise, it is easy.
Thank you, ma'am. I hope every student watching this implements this in their life.
Yes, yes.
And my next question is to Dr. Manav. Can we consider HPOT as a treatment for children with asthma and breathing related problems?
Oops, sorry, I had muted myself. All right, so the last question had a part about is it only for treating medical conditions or can anybody take hyperbaric oxygen? So I will combine the answer to that question and this question. Look, we must understand that hyperbaric oxygen is like any other medicine, right? Any drug. It could be as simple as paracetamol. I mean, what you take for fever. But you don't take paracetamol just because you get up in the morning and decide कि चलो यार आज breakfast में paracetamol खाते हैं मजा आएगा. You know, it doesn't work like that. You take a medicine because you need a medicine. It's not just for the heck of it. Similarly, hyperbaric oxygen is also given as a medicine. So can anybody take it? The answer is no. Anybody cannot take it. It is only if it is prescribed for certain conditions, one. Secondly, is it used for treating only medical conditions? Well, medical and surgical conditions. There is a long list of conditions. We'll talk about that later. Especially now we're talking about asthma. Your question, Niranjana, was about asthma, whether we can use it to treat children with asthma. Now, there are certain investigations that we do before we administer hyperbaric oxygen to anybody. And one of those investigations is something known as pulmonary function testing or a PFT. This PFT will tell us whether there is any obstruction or any restriction. So there are two types of problems in the lungs. One is called an obstructive pathology or it could be a restrictive pathology. The classic example of an obstructive pathology is bronchial asthma. All right. And if on the pulmonary function test, okay, let me rephrase it. If the pulmonary function test shows an obstructive pattern, we do not, I repeat, we do not give hyperbaric oxygen. So to answer your question, asthma is a big no-no. If a child has asthma, definitely no hyperbaric oxygen therapy. However, if there is a restrictive pathology, yes, the child can be given hyperbaric oxygen. But let me make this very clear. I'm not saying that hyperbaric oxygen is prescribed for restrictive lung lesions. It's not. It's what I'm trying to say is that if the child or the patient has a restrictive lesion and requires hyperbaric oxygen therapy for something else, yes, they can be permitted to have hyperbaric oxygen. Obstructive lesions, no.
All right, thank you very much. My next question is to Dr. Kajal Doshi. I think this is a very common question. Typically, how many sessions of osteopathy would be required for one to see evident results?
Well, that depends on the case. Say if you're a child who's coming to take a session, since children are, they're very adaptive, they're very receptive to anything that they receive. I would say you can see noticeable difference in even one session. But if you were to talk about adults, that really depends on how chronic the issue is, if they have multiple conditions going on, and what kind of a person they are, what is their routine like, and if they take our homegoing advice as seriously as they should. But on an average, I would say around 3 to 4 sessions is a good number for you to see a holistic or a complete, say complete resolution of the problem or a good result, evident result for that matter. Yeah.
Okay, thank you. And next is to Dr. Siddharth back again. What are the typical health conditions that can be treated with ozone therapy? Can ozone therapy also be taken for general well-being?
Yeah. So conditions like we know that ozone is a very potent germicidal. Like ozone kills all the virus, fungi, and bacteria. How it kills? Like it ruptures the outer layer, the membrane of the bacteria. So it kills bacteria. Like we have seen in packaged drinking water. If you see they treat it with ozone. Like they kill the microbes through ozone only. They bubble ozone, they kill it. So ozone is a very potent germicidal, so we can use in infectious disease, like any known healing ulcer is there, wounds are there, so we can use. In ENT, like any sinusitis problem is there. In dental infections also ozone can be used. And ozone can be used for cancer. Like as a supportive treatment, we can use ozone in cancer along with mainstream line treatment, like other radiotherapy is there, chemo is there. Parallel to that, we can use ozone therapy. Ozone therapy can be used post-COVID symptoms. What are the symptoms? Sleep deprivation is there, brain fog is there, memory impairment is there, energy, low energy levels. People are suffering of low energy levels. So ozone increases ATP production in the body. So more ATP, more energy. Ozone therapy can be used in skin conditions like eczema, we can use autoimmune disease, arthritis, ozone can be used, rheumatic arthritis, we can use ozone therapy, spondylitis, we can use ozone therapy. So there are various conditions in which we can use ozone therapy.
Okay. Thank you, doctor. That was very insightful. I'll pass
And
it back.
your second question, as for general well-being, can we give ozone therapy? For general well-being, if a patient is sleep deprived, if a patient is feeling very low in energy, we can give ozone therapy to them. And ozone therapy can be given in asthma also. Like there is a treatment called breathing ozone through oil. So we can give in asthma ozone therapy. And ozone therapy can be given for anti-aging. Ozone has an anti-aging properties. So everybody wants anti-aging, not in your age, in older age. So ozone therapy can be given in that condition also.
Okay. I'd like to pass it back to Ananya to ask a couple more questions.
Okay, so there's one more question for Dr. Manav. The question is, I have heard that SBOT can help athletes recover quickly from injuries and people take it as treatment for anti-aging. Can you elaborate on this?
All right. So anti-aging properties of hyperbaric oxygen, that's actually a very interesting line of questioning, because this is one area which is where the house is divided as to whether it works or not. Okay, so let me start off by telling you that, Ananya, how old are you, if I may ask?
I am 14.
All right. You know who's Michael Jackson, or rather who was Michael Jackson?
Yes, of course.
All right. So yeah, no, I wasn't too sure whether kids your age remember Michael Jackson or not. So they say that Michael Jackson had his own hyperbaric chamber at home. And he used to take hyperbaric oxygen as an anti-aging kind of a thing. And we all know how weird he looked, right? He had that funny, extremely fair skin. He was black by birth, by the way. All right. So now to address your question directly as to whether it helps in what was the question, is diabetic wounds, right? And the question was diabetic wounds and anti-aging, correct? Or just anti-aging?
Anti-aging, and as well as how it helped in curing athletes' wounds.
Yeah, athletes, sorry, I'm sorry. It was about athletic injuries. So one of the mechanisms of action of hyperbaric oxygen is that it enhances the formation of collagen. Collagen is the basic framework around which most of the connective tissue of the body is made. All right. And in the synthesis of collagen, the last step, which is actually, it's got to do with proline and lysine, two amino acids. This last step in the synthesis of collagen is actually oxygen dependent. I'm trying to break it down into absolutely simple terms. The last step is oxygen dependent, and therefore hyperbaric oxygen, by giving more oxygen, as the name suggests, sort of enhances the formation of collagen, thereby promoting healing of athletic injuries. All right, because anything torn or anything broken heals slightly faster with hyperbaric oxygen. So yes, it is sort of beneficial in athletic injuries. But anti-aging, now that's a question which doesn't really have an answer. So you must understand that there are some established indications for the use of hyperbaric oxygen therapy, of which there are only 14, right? Only 14 indications for hyperbaric oxygen therapy. And these indications are given by an agency known as the UHMS, or the Undersea and Hyperbaric Medical Society, which is sort of the authority on hyperbaric medicine across the globe. Okay, so the UHMS has 14 established indications, of which anti-aging is not one. Number two, there are certain experimental indications for hyperbaric oxygen, which includes diseases like autism, for example. Autism in children, yes, there is some evidence to say that by virtue of enhancing the cerebral blood supply, there is a bit of benefit in patients in children with autism. Even there, in the experimental indications, also anti-aging is not one of the indications. Having said that, there is some evidence to some evidence. Most of it is anecdotal. Very little, very little scientific evidence to say that it actually has some anti-aging effects by virtue of its antioxidant properties. All right. So to ask me whether hyperbaric oxygen has anti-aging effects, I would say the answer is no, frankly speaking. But then we all know Michael Jackson, right? So going back to the same story. So I really I don't think it is an indication for anti-aging. So if you want to look younger, well, I'm sure there are a bunch of other ways of doing it. There are multi-billion-dollar companies promoting beauty products just for this. So I'm sure there are better ways of doing it. Hyperbaric oxygen is unfortunately not one of them.
Thank you so much, sir. My next question would be going to Dr. Siddharth. What are typical health conditions that can be treated with ozone therapy? And can ozone therapy also be taken for general well-being?
Yeah, I have answered it.
Oh, yes. And along with that, if any, like, for example, ozone therapy, we have been talking about giving it ozone, right? The body receives ozone. So how is that different from HBOT? Because HBOT is also about oxygen and ozone is about like getting another form of oxygen. That's a bit confusing for me.
Yeah, HBOT and ozone both are little bit similar, but ozone is a different thing. Like oxygen, it has two molecules, but ozone has extra one molecule. And ozone has different properties. Ozone is heavier than the other gases. So ozone is different, and HBOT we use oxygen in a particular pressure. So ozone, and there is a difference between ozone and oxygen. In HBOT, we place the patient in a chamber in which oxygen pressure is there, but in ozone we can give through different routes, like through ear we can give, through skin ozone get absorbed, intravenous also we can give ozone. So different routes we can, rectal ozone can be given. So ozone is different and HBOT is different. Yeah, but function is little bit same. Both gives more oxygen to the tissue cells.
Thank you for clearing this doubt. My next question goes back to Dr. Aarti Mohan. The question is, ever since the pandemic, my son has been addicted to the cell phone. I am always worried about his eyesight, like Panchakarma for elders. Is there any Ayurveda practice that can help?
Okay, Ananya, thank you for the question. So you were asking regarding the phone addiction and methods to prevent the same, right? Like eye strain, regarding eye strain. See, the phone addiction in the sense, it is often the parents to blame when the child is addicted to the phone. Okay. See, where did the child get the phone in the first place? That is the first question. Nowadays, even a 10-year-old boy or a girl, they come with a phone. Like when you take a walk around the apartment, you can see even children going out with phones. They will be playing video games. They will be watching some movies, everything. They have access to phones. That is the main issue we are facing now. More than the addiction, it is the parents to blame. That is a different topic again. Ideally, 2 hours of screen time is admissible, but you can divide it into 30 minutes over the day. So not more than 2 hours. 2 hours is maximum that you can give. But even when I am telling that, you should give a break in between. So you should always follow the 20-20-20 rule. So 20-20-20 rule means every 20 minutes you are spending on the screen. So every 20 minutes, a 20 feet object should be looked for 20 seconds. Understood? So if you're on the screen, maybe you are having an online class or any session like this. If more than 20 minutes, you take some 20 seconds just to stare at an object which is 20 feet away. That is one thing. And also there are certain, and again, the parents can set timer or time limits. Okay, you watch for 20 minutes, you take a minute, 5-minute break and come back. I'll give the mobile. Okay, you assure the child, but anyways, less than 2 hours you'll be getting that too in divided timings, but in between you will have to take the break. That is sure shot. That is anyways required. Now there are a couple of eye exercises that you can follow. See, in our Sri Sri Hospital, we have the Shalakya department, which is guided by Dr. Naveen sir. There is Dr. Geeta madam. There is Dr. Krishnan sir, and also under their guidance, there are PG students as well and interns. They are recommending a lot of eye exercises. See, now that the summer vacations have come, a lot of students and kids are coming there for treatment as well. So some of the eye exercises I have seen that they are following. One is cupping, which is very easy to do. Maybe you also know, where you use this part of your hands. Okay. And the right hand, this part will go to this side. Left eye, this part will go to left eye. Then you will just cup your eyes. So this part will be pressing onto your eyes. Okay. And then you rest your elbow on a pillow or something. If you are sitting next to a table, you can put your rest your elbow upon a a pillow, and then just do the cupping. So some 30 minutes or so, if you're staring on the screen directly, you do this cupping for at least some 4 or 5 minutes, 2 to 3 minutes you can do. And you can think of a pleasant moment. So that is a kind of relaxation for the eyes as well as the mind. Okay, we can listen to music also. So if, even to an IT professional or any children or anyone who is on the screen for a long time, this cupping is actually very nice. You can do in your workplace also. Okay. So other than cupping, you can do focusing. Okay. So you focus at something which is on your table, and you focus at something which is on the window pane or some distance away. That is a near and far object you can focus. So you concentrate or focus on the near object for say 2-3 seconds. Then look at the focus at the distant object for 2-3 seconds and alternate that. So that is kind of focusing in the near and far object. Okay. You can zoom in and zoom out. You focus on an object and you move it close to the eye and move it back. So that is zooming in and out. You can wash your eyes frequently with distilled water, not with the tap water. The water you are drinking, you can use to wash the eyes very often. Then fast blinking. Usually when you are looking at the screen for too long, what happens? The cornea gets dried out very quickly. Okay. So what you can do is fastly, you can blink your eyes for seconds. Okay. So that will help to retain the moisture. It will make your eyes more moist. Then what you can do is, yes, these are some of the simple techniques, but again, there are a lot of techniques which are employed in our hospital. Those who want to know further actually can visit the hospital in the Shalakya or the ENT OPD of our department. So there you will come across many procedures, and also Panchakarma procedures are there. See, nowadays anti-glare specs will be available, anti-glare glasses. Okay, no power anti-glare glasses. Even anti-glare screen is available. So you can put on the screen as well, or you can have the specs or the glasses, which is anti-glare. No power is available. Okay, so that can be given to children. To an extent, it will prevent the rays. Okay, and try to even the screen brightness. You may decrease the screen brightness, which will suit the environment. There are a lot of Panchakarma procedures which are there to relieve the eye strain. Like we have the dhara, where the medicines, medicated oils or ghees, decoctions or milk decoctions will be poured on the eyes. The same medicines can be retained on the eyes. Okay, there are nasya procedures, then oil massages, shirodharas are there, where the oil is retained on the head. A lot of Panchakarma procedures like that of the adults we have for the children as well. So you can visit the OPD anytime, the Shalakya OPD anytime, to have all these treatments sorted out and bit out. But the main thing is not the eye strain. It is from the addiction, which is directed to the parents. So it is up to them. This whole responsibility of keeping the timer and having a strict regime to follow for this, that should be maintained by the parents. But we have treatments for all this. Please visit the OPD for that purpose. Okay. Thank you. Thank you, Ananya.
Thank you, doctor. And I will certainly make sure whenever I get the opportunity, I will visit the hospital and I
Sure.
will try to see of some of the Panchakarma treatments and procedures.
Yes.
There's one more question for you. Uh, in our busy lifestyle, especially in like 9th, 10th, 11th, 12th, these are the main years, and most of us are busy studying, even in our in daily adult lives. Like most of the people are busy with their office work. There's not much time that we get to focus on ourselves. So, what are some ways that we can practice Ayurvedic procedures and Ayurvedic treatments, or we can practice Ayurveda in our daily lives without disrupting anything that is there in our schedule?
See, this bathing in the sense, you can use a lot of oils are mentioned in Ayurveda. I cannot name as such now, but you can have an oil massage, a head massage, oil massage of the body, and take a good bath. When you're bathing, don't use hot water over the scalp or the head. If you're bathing, you can you can bath in warm water, but your head should be washed separately, and that too with mostly it is good to bath with the distilled water or whichever water you're using for drinking purpose. Okay. Pada Abhyanga, that is, if you are applying oil over the soles of your feet, that will help relax your eyes as well. So Pada Abhyanga and whole body Abhyanga. Abhyanga is nothing but oil massage and head massage. That is all good for health. And 7 to 8 hours of sleep is absolutely required for you kids. Okay. For the growing age, it is very much required for all the metabolism in the body that is happening. You are drastically growing in this period. The growth spurt is happening. So that is absolutely necessary. And also, don't always be in front of the books. You should find time, some 30 minutes or so. You should go out. You should mingle with your friends. So have some walk. Some brisk walk is necessary. Okay. And 2.2 to 2.5 liters of water daily. And healthy, balanced diet. So what I mean is the whites, when you say the breads, the white breads, more of cheese, okay, the fast foods, this has to go down in your diet. Okay, once a week is fine, or twice a month is fine. But in regular diet, whatever from home, what your mother is cooking, see, your mother is your best guru. Okay, whatever she is saying is for your good. So you have to understand that whatever she is giving, that is for your health. So what you have to just concentrate is on your studies. Everything your mother is giving, you are supposed to eat. You are not supposed to speak against her or talk back to her. Mostly when it comes to food. Okay, whatever she is giving, that is on the best interest. Eat a lot of fruits, lot of vegetables, seasonal fruits. Now that the watermelon, papaya, and everything, all the seasonal fruits you can have, and you always maintain a timetable for your study purpose. Okay, don't sit and study from 5 to 7 the same subject. You take breaks in between. 20 minutes of study, if you are doing, that is good enough. Take a 10-minute break. Again, you go back to your study. So that is necessary. And in between, you can have a Kit Kat break. As I was saying, a sweet break you can take in between. Lots and lots of water and enjoy study. Okay. And I take this opportunity to thank the SSRVM Trust and my beloved principal, Dr. Sudhir sir, my dear, my HOD, my Dr. Sudhir sir, who is the HOD of the department, beloved principal, Dr. Sajida ma'am, and SSRU students. It was nice interacting with you on this special day, on the health day, health education. You should know we should actually spread across the country or across the world that these kind of treatments are happening in our department or in our hospital. We have a full-fledged OT, HBOT, and osteopathy. Everything is running hand in hand. We are helping each other. We'll assisting, and even we refer patients to other departments, these other departments. So we are all working hand in hand. We are doing everything to keep to help the students, help the kids, help the adults who are coming. In all ways, we are trying to help have a better life. So thank you. Thank you, Dr. Manav, Dr. Kajal, and Dr. Siddhartha as well. Thank you. Jai Gurudev.
Thank you so much for joining us over here and giving us so much knowledge. Thank you for helping us with all the problems that we are facing right now. For us students, it's actually very helpful because we are very swamped with all the work that we have to do. Even for adults, they are very swamped with their office work and whatever work they're doing. So it is very helpful when doctors like you spread knowledge amongst us, and we can apply this knowledge in our daily lives safely without any bad, severe side effects. Thank you so much.
Thank you, Aranya, Niranjana. Thank you, all the doctors, SSRVM Trust.
Thank you, everybody. Great talking to you, Ananya and Niranjana. Awesome. All the very best for your life and for your exams and so on and so forth. I hope you become the successive presidents of India someday.
Thank you so much, everybody. It was really an insightful session. Even I got to know about the different medical treatments we have available at our hospital. So yeah, I urge all of you to come, have a look, get yourself checked. All right. Jai Gurudev. Thank you.
Jai Gurudev.
Thank you. Jai Gurudev. Happy
Jai
World
Gurudev.
Health Day.
Bye-bye.